My name is Olwen Minford. I'm an end-of-life care facilitator and an integrative psychotherapist based in North London, currently facilitating end-of-life care in care homes. I just want to reiterate to everyone, congratulations on getting past the big red chair and arriving here today. It's a wonderful achievement. And by now you will have heard a lot of phrases connected with the Churchill Fellowship, from fabulous, brilliant, life-enhancing, opportunity of a lifetime. Guess what? It's all true. In my own words, amazing. For me, the story really began about 10 years ago when I started working in London and Winston popped into my email box. I remember being galvanised by this prospect of this opportunity and thinking, I'd love to do that someday. And I just tucked it away at the back of my mind. So last year, on the 14th of February, Winston popped through the letterbox once more to confirm thrillingly that I'd been awarded a fellowship, and it's the best Valentine's letter I've ever had. I was awarded the fellowship to look at improving communication training and compassionate care using arts-based methods. And I wanted to look at two things, one being the use of innovative educational programs using arts-based methods, the other being the impact on communication of arts and medicine programs in hospitals. I was able to go for 8 weeks, which was really generous. I went to USA for 5 weeks and I went to Australia for 3 weeks, and it was split into 2 phases. Basically, none of you here will be surprised with a medical background or even in the public about the problem that we have with communication. The healthcare scandals that, the Francis inquiry particularly, that have flagged up that we are not great at communication. In my work as an end-of-life care facilitator, I was meeting this all the time. Over 60% of complaints to the Ombudsman are due to poor communication at the end of life. So basically, I was addressing this using the arts and workshops, using visual images, using poetry, and it seemed to be having some impact in helping people tackle the elephant in the room and actually dismantle the taboo around death. So I was really curious to go and see what other methods people were using across the world. So what happened next? Everything was going swimmingly, and then I just felt really overwhelmed. Basically, I think I phoned Julia, which I'm not recommending because she's very busy. The office were really helpful. And once I settled down, one bite of the elephant at a time, put out feelers. In my case, I didn't have that many contacts, but Google for 2 months kept telling me, you are out of gigabytes. And slowly things started to happen. I think for me it was trusting the process, quite nerve-wracking, but it did begin to take shape. So I learned about tweeting and blogging and all these other things in between times, quite a steep learning curve. Where did I go? Well, I chose to start off with conferences in both countries. I went to Houston and was very fortunate to attend the 25th Global Arts Festival, Arts Conference, and that was amazing to be absolutely immersed in your topic and meet all these thought leaders, clinicians, academics, and then of course artists. The Harlem Picasso was one of my meetings in New York. He's beautifying the sidewalks of Harlem with graffiti art. He's an 85-year-old ex-con, and I just thought he was amazing. So I went to what really highlights, specific to my research, one of the most exciting programs I saw at Yale was the use of art galleries and museums to train medical professionals. And I was invited into a program with medical students where they were being taken into art galleries. And this program was conceived about 14 years ago. It's now being rolled out over 25 universities in USA, and it is evidence-based. Basically, it's enhancing observation skills, it's improving empathy, it's improving emotional awareness. There's a reflective theme right through the process, and it improves visual assessment and critical thinking, and overall it improves multidisciplinary team working. So it was an absolute privilege to be with a group of medical students inventorying this painting, and it was a set process. We were given 12 minutes to actually inventory the painting, and then another 20 minutes for general discussion. And the art educator was a bit like a consultant, firing questions. Tell me why you see this, tell me more about that. It was quite scary, but the whole thing sort of modelled a presentation of a case history. And I asked one of the medical students, what did you think about this? And he said, I think it's fantastic, because as a doctor you're trained to be right, but it lets you see you're not always right and you're listening to other people. I visited, I saw lots of other things which will be in the report in terms of education, but the arts and medicine programs that I visited, and was really fortunate to spend a week in Florida at Shan's Arts and Medicine program, where I worked alongside 16 artists who are actually part of the healthcare system. And so here we have songwriting with cancer patients in the Royal Melbourne Hospital. The Royal Melbourne Hospital itself is an absolute delight, because it's got an art program, and it's amazing. I saw the impact on communication of a beading program in the chemotherapy suite in New York. So powerful that one of the patients said, I can't wait to come back for my next treatment. I saw the impact in the dialysis unit. This patient told me that since she'd been making the quilt, she felt so much better, her life had improved. I saw how art acts as the third thing, as a communication bridge. When her dialysis machine was going beep, 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 and staff would come up, switch it off, but they'd immediately turn to the quilt and talk about the colours, and it was so much more person-centred, naturally. I had the privilege of dancing with people who had Parkinson's disease, and witnessing, how that illuminated them, and equally with people with profound disabilities. The installations in this particular hospital in Shands were amazing. This is a collaborative art piece done by patients, families and carers. It also acts as a memorial where they can go back if the person has died and actually, have a memorial there to look at. The impact of music occurring naturally, tunes in the tunnels. And I think probably one of the most profound events was when I accompanied Ricky, the musician, on his rounds in the hospital, in the oncology ward. And the absolutely powerful impact of music on a patient, as she told him afterwards that he'd given her the first piece she had had in 2 days. Well, longer than that actually. Not only was the impact for Ricky, myself and the patient, but a nurse came in from outside and said, I just want to hear the music. So I think there's a bridge there between the nurse and the patient to have those, maybe a way into difficult conversations whenever we left. So I think that also I was witnessing what research calls the happy patient, happy staff effect, and I write more about that in my report, but the impact is for everyone. Along the way, incidental highlights, there are just too many to name. Reunions with family and friends, the kindness of strangers everywhere, the coachman who drove me to my destination off track and said he would lose his job if I told anybody. I also find myself in the Supreme Court in Sydney Law Courts on the right side of the law, witnessing someone be admitted as a solicitor there. I have the distinction of coming second in a swimming race in Sydney, in Balmoral in Sydney, after diving off a plank, which I haven't done for years. But all in all, just miraculous things happened. So what now? And as Jamie said, I think the real work begins now. I've just been back a couple of months, but I have been consistently working, and I think I've had a couple of things published in blogs, articles. In terms of influencing future health policy, because what we really want is to bring the arts more into mainstream healthcare. And so I'm linking and liaising with the regional directors of arts and health forums, with clinicians. The National Alliance is working with the All-Party Parliamentary Group for Arts, Health and Wellbeing. So there is momentum, and it's about driving that forwards, and I hope my report report will go some way towards that. One of my aims was to contribute to medical and nursing education, and I've been invited as an associate lecturer to contribute to King's College London, and I've taken part already in one session, so I've achieved one of my own aims. I think just disseminating through conferences, through speaking, I'm a member of the Pain and Palliative Care Committee in RCN, so I hope to speak at RCN Congress this year, speak to London End-of-Life Care facilitators. I'll really speak to anybody that wants me to, because I love the subject. And basically I will continue to practice using the arts. That's really whatever way I work. See Jamie standing up there. I'd just like to finish with a poem, if that 1 minute. I use a lot of poetry in my work, and this poem had special significance while I was travelling, and it's by Mary Oliver. Who made the world? Who made the swan and the black bear? Who made the grasshopper? This grasshopper, I mean. The one who has flung herself out of the grass. The one who is eating sugar out of my hand. Who is moving her jaws back and forth instead of up and down. Who is gazing around with her enormous and complicated eyes. Now she lifts her pale forearms and thoroughly washes her face. Now she snaps her wings open and floats away. I don't know exactly what a prayer is. I do know how to pay attention, how to fall down into the grass, how to kneel down in the grass, how to be idle and blessed, how to stroll through the fields, which is what I have been doing all day. Tell me, what else should I have done? Doesn't everything die at last, and too soon? Tell me, what is it you plan to do with your one wild and precious life? And I do hope your fellowship helps you to do that. Thank you.